the concept of how mental health and chronic stress has now been shown to be a factor that is triggering these conditions. And you could prove me wrong, but I think when somebody is chronically stressed and you're chronically releasing cortisol, you're bound to end up with either one of diabetic, hypertensive, and develop other chronic conditions. Am I right, or am I speaking my own gibberish?
No, you're absolutely right. Chronic stress has been shown to increase sugars. It's a known fact. And you yourself, Jackie, you said when you
Yes.
had chronic stress, you noticed changes in your body, right? When I was doing my residency, I had chronic stress, of course, and I noticed changes in my body. I
Yes.
gained a lot of weight. I had skin breakouts because my PCOS wasn't well controlled because of the stress and gaining weight. I have seen it in my patients. I am a strong advocate for using the continuous glucose monitoring. You know, that the thing that you put here, and then for 14 days, it tells you what your sugar is like. And a lot of times when it's high, like I had a patient, I think last week, her sugars just started going high and I was like, and she had been well controlled before that. And then just a week, I could see that in that 1 week, her sugars were high. She's eating the same thing. She's exercising the same way. There's nothing that has changed apart from the fact that she had some family stresses. And you can just see immediately she learned about it, the sugar just went up. Pressure, same story. Yeah, so cortisol is definitely a big factor in all this, and part of the management of diabetes, like even in the guidelines now, stress management and good sleep is one of the
Yes.
medications we give, because sleep is so important. We underestimate the importance of good sleep. Good sleep is medicine in diabetes. It's as good as a medicine. And I would say not just in diabetes, I think it's a medicine for so many more things, many more chronic illnesses, for your mental health. Sleep is very important. And then managing stress. So the thing about stress is I think that the what I usually tell my clients is it's normal to get stressed, but now it's about getting coping mechanisms for the stress, because life in itself, Jackie, is stress. You're never gonna just be there
Yes.
just going. And in fact, if you're in a place where you're not having a stressor, in a manisha, you need to look and figure out what is there something. Why? You're pushing yourself. It means you're not pushing
That's
yourself.
true.
But
Enough. Huh?
enough, or stress could also come from outside areas. People have family issues, people have health issues, but then getting the coping mechanisms, and that's where mental health guidance comes in. And that's why a psychologist, a counselor, a psychiatrist, or just a mental health team is very important in the whole concept of diabetes care, and in all chronic illnesses mental health is absolutely important. So I fully agree with you.
There's a client I had, and I think I even posted this in one of my stories. I submitted it as an article under KMA, Kenya Medical Association, where we had a client who it took about 2 to 3 years for them to accept to take medication. And now this pushes me to the concept of compliance, adherence, acceptance, denial, where you're finding somebody has sugars as high as 25, 20. You tell them, they look at you, they're like, eh. I remember that client had sugars of high as 14, 18, and then the blood pressure was in the ranges of 200 over 110 around. And I met this person during a medical camp. So I meet them and I tell them, the way we've recorded, this one's neat. This is urgent. These are emergencies and urgencies. Your organs could be going into failure or complicating. You know, the person tells me, no, I'm very busy with work, so let me just rush this way, I'll come back. And you know what? As a trustworthy Jackie I am, I told him it's okay. But I was always on the lookout waiting to see if I will spot this person. So day two comes, person has not yet come to me. I literally went and grabbed that person, come. I want to check again and see how you're doing today. Of course, I knew what the result would be because nothing has changed. Documented him, told the person, these are the sugars, these are the blood pressures. Yesterday was this, today is this. You need to start on medication. Person looks at me, is like, you write for me a prescription and go and Bye. That is what I do. So I wrote the prescription, but in addition, I also wrote some tests because I was like, no, this one, there's need for urgent help. And I also gave him a start medication just to help lower the blood pressure. And I talked about diet, lifestyle, mini, all these passionate things. I called the person after a few days, no response. I messaged, no response. 1 month, 2 months, 3 months in. Around 4, 5 months, the person responds and says, I took the medication that you wrote and I took it for 1 month and I saw the pressure was better and I stopped. Me, I almost fainted because in my head I was like, oh my God.
Mm.
Now this is a complication that you're bringing. You're so far away, I cannot even come and just keep monitoring you that closely. I literally need someone. Okay, I said, fine. So reappearance, reassurance, recounseling. Look here, you cannot just stop your medication. You have to be monitored. Did you do the test I asked you? No, I am busy, doc. Let me call you back. I have not done the test. But what I noticed all through this time is that his job is very stressful. And number two, what else ended up happening? He ended up getting into alcoholism. After he got the news of learning that there was pressure and diabetes, he now tipped over into alcoholism because it was a safe space for him and a comfort space. Because now, what are these things I'm being told? I'm 40 something. So it got to the point his wife had to look for me through his phone because now she was scared that my spouse is going to die.
Yeah.
The way I am seeing, my spouse is going to die. I can see somewhere you wrote medication was not taken, he stopped. I don't see him taking medication these days. Please look for him. This is somebody begging me to look for him. I'm like, so I look for the client. I'm like, I am short of coming to where you are. I can even take a car, and if your problem is finances, I will not charge you. My problem is the fact that you are going to complicate and more so even die. And the fact that these are high, it probably started a long time ago. But long and short is the fact that it took a journey, and I recommended even a counselor and a psychologist just to help with the person accepting and actually now realizing this is a problem because now there was also the problem of alcoholism. What are these habits we can change or alter with? Because you're stressed, as you said, how can we cope with this stress? We can meditate, we can pray, we can journal, we can socialize, we can go and laugh, you can go dancing, you can go exercise. There are different ways of managing stress. And so I told them those are the different routes you can take. And the counselor also recommended those things. Another thing that I realized I had done to complicate his life was putting him on an expensive antihypertensive. Yes. So it got to the point where his monthly expenses were so much. So he decided, let me stay without it because the expense is too much for my family. So I told him, okay, fine. You have other options. And that's now how he accepted to now be on now a more affordable antihypertensive as opposed to what I had given. And I realized now that was from a me perspective. I was also involved in poor adherence from the fact that I did not assess the situation or I did not learn more from the client just to be able to know, okay, this is too much for you from a financial perspective. Let me do a more affordable version that will also do the same job.